Guys, let me be honest with you right from the start. After 60, the overwhelming majority of your day is spent sitting. At the office, at home, in the car, at the kitchen table, in front of the television, wherever life takes you, you are sitting. And I know that seems completely harmless. It is, after all, just sitting. It's what we do. It's rest. It's comfort. There's nothing alarming about a chair. But here is what nobody is talking about, and it is precisely why I made this video for you today. The way you sit, that flat, relaxed, completely ordinary position, is silently, steadily blocking blood flow to your penis. It is compressing your pelvic floor. It is cutting off the signals your nervous system needs to produce morning erections. And the most devastating part? Most men have absolutely no idea this is happening. Because it doesn't happen suddenly. It doesn't announce itself. It happens gradually, over months, over years, one long sitting session at a time, until one morning you wake up and realize something has changed, and you don't know why. But I want you to hear me clearly on this. I am not here to tell you to stop sitting. I am not going to ask you to completely restructure your lifestyle or your daily schedule. I am not going to recommend expensive equipment or complicated therapy programs. What I am going to show you today is how to take something you already do every single day, sitting, and turn it into an opportunity. An opportunity to restore circulation, to reawaken muscles that have gone dormant, to bring back the morning erections that you assumed were gone for good, or worse, that you quietly accepted as just another part of aging. I came today with a very specific, clinically grounded technique. And the only tool you need, the only piece of equipment this requires, is something every single person already has in their home: a chair. If your chair is ready, I am ready to begin. I'm Dr. Jocelyn. I have spent 14 years working in men's health, and I want to share something honest with you. When I first encountered this technique, I was genuinely skeptical. I want to be transparent about that because I think it's important that you know I did not simply accept this on faith. I have reviewed a great deal of research over the course of my career. I have seen trends come and go, and when a colleague first walked me through this approach, my immediate reaction was doubt. It seemed too simple, too accessible, not technical enough to produce real measurable results. But here is what 14 years of sitting across from real men dealing with real problems has taught me. Simplicity is not the enemy of effectiveness. Sometimes the most profound solutions are the ones that require nothing but the right knowledge and the discipline to apply it consistently. So we tried it. I introduced this technique with a group of patients in my practice. Men between the ages of 55 and 72, men who were experiencing weakening erections, the loss of morning firmness, and the quiet embarrassment that comes when your body stops responding the way it used to. Men who had started to believe that this was simply the reality of getting older. And 3 days after beginning the technique, messages started arriving. One man wrote to tell me his morning erection had returned for the first time in nearly 2 years. Another said he hadn't felt that kind of response in his body since his late 40s. I was stunned, right alongside my patients. We were all surprised together, and that shared surprise, that shared relief, is exactly why I want to share this with you today. Before we get into the technique, I want to take just a brief moment to connect. We haven't checked in for a while about who is watching and where you're tuning in from, and I genuinely love knowing. Drop a comment below, tell me your city, your country, wherever in the world you're joining from today. Seeing your messages from so many different places really does motivate me to keep creating content like this for you. And if you haven't subscribed yet, please do that right now. Hit that subscribe button so you don't miss this technique or the important videos I have coming in the future. All right, let's get into it. Let's talk about what is actually happening inside your body when you sit. Why is this position, something so routine, so unremarkable, so much a part of every ordinary day, causing serious and progressive damage to your erectile function? I want to walk through this with you slowly and clearly, because understanding the problem at a physiological level is what makes the solution genuinely make sense. First, your pelvis tilts backward. When you sit flat, and especially when you sink back into a comfortable sofa or a reclining chair, your pelvis automatically rotates backward. This is not a conscious choice. It is a structural consequence of the position itself. Your body always follows the path of least resistance, and in a seated position, that path leads the pelvis to roll back. And when this happens, the muscles of your pelvic floor, the deep internal muscles that are responsible for controlling erections and for trapping blood within the penile tissue, they go completely offline. They become passive. They stop working entirely. And when pelvic floor muscles aren't working, they cannot support or maintain strong erections, because that is literally their anatomical function. Second, your perineum is being compressed. The perineum is a small but anatomically critical area of soft tissue located between your testicles and your anus. Directly beneath this region sits your prostate gland, and running through this area is the elaborate network of nerves and blood vessels that govern your entire erectile function. When you sit flat on a hard chair or even a moderately cushioned office seat, you are applying direct, sustained pressure to this region, hour after hour, day after day. The surface of the chair is compressing this sensitive anatomical area. Blood flow becomes restricted. The nerves in this region, subjected to constant compression, gradually begin to lose their sensitivity. When those nerves go numb, even partially, the signals required to trigger and maintain erections become weaker, slower, and less reliable. Third, your hip flexors are structurally shortening. The hip flexors are a group of muscles at the front of your hips, connecting your spine and pelvis to your femur, your thigh bone. When you sit for extended periods, these muscles are locked into a shortened, contracted position for the entire duration. 6 hours a day, 8 hours a day, day after day, for years. And over time, they don't simply stretch back to their natural length when you finally stand up. They actually adapt to their shortened state. They structurally lose their ability to fully lengthen. Chronically tight hip flexors restrict blood flow into the pelvic region. They also pull your pelvis out of its correct anatomical alignment, which compounds every other problem on this list. It becomes a self-reinforcing cycle of restriction. Fourth, your core musculature shuts down entirely. When you sit in a passive, flat position, your abdominal muscles, your lumbar back muscles, your deep spinal stabilizers, and your pelvic floor are all completely inactive. They are switched off. They are doing nothing. And this matters enormously because these muscle groups form the structural architecture that supports the entire pelvis and, by extension, the entire erectile system. When this architecture is inactive for hours every single day, year after year, it weakens. The structural integrity of your pelvic region deteriorates. The foundation of your erectile function becomes less stable, less capable, less reliable. Fifth, your circulation is significantly reduced. The seated position compresses the major blood vessels in your upper thighs and groin, which impairs what we call venous return. The ability of your circulatory system to move blood back up from your lower extremities and redistribute it throughout your pelvic region. In practical terms, blood struggles to flow freely into your pelvis and from your pelvis into your penis. Reduced blood flow to this region means reduced blood available for erections. And at their most fundamental level, weak erections are a circulation problem. Now consider everything I have just described and apply it to your daily life. You are spending 6 to 8 hours every single day, possibly more, with your pelvis tilted backward, your perineum compressed against a hard surface, your hip flexors locked into a shortened position, your core and pelvic floor switched completely off, and your pelvic circulation significantly restricted every single day. And your body, being the extraordinarily adaptive organism that it is, begins to treat this as the new normal. Your muscles forget how to activate. Your nervous system stops sending the signals it once sent instinctively. Your circulatory system stops prioritizing a region it has learned to deprioritize. Morning erections disappear, not because you are broken, not because of your age, but because your body has perfectly adapted to a position that systematically switches off the systems responsible for producing them. Most men, when this happens, draw one conclusion: I'm getting older. This is just what happens now. And I understand why. It's the obvious explanation. It's the explanation that feels safe and requires no uncomfortable investigation. But it is not the correct explanation. And quietly accepting it means accepting something that does not have to be your reality. This is not an inevitable consequence of aging. This is a correctable consequence of how you have been sitting. And I am going to show you exactly how to correct it. Here is the technique. Pay close attention now, because the specific details of the positioning matter. Most of the men who attempt this and see no results are making one or two small but critical errors in form. Let's make sure that does not happen to you. Step 1. Sit on the very front edge of your chair, not in the center of the seat, not slightly forward. The very front edge. Approximately half of your buttocks should be in contact with the seat, while the other half hangs off the edge, completely unsupported. I know this may feel slightly unusual at first, perhaps a little unstable. That sense of instability is intentional. It means your body is being asked to engage. This specific position is precisely where your pelvis can rotate into its correct forward angle, where pressure is lifted from your perineum, and where your pelvic floor muscles can begin to reactivate. Step 2. Plant your feet firmly on the floor. Keep them shoulder width apart. Distribute your weight evenly between the front edge of the chair and the soles of your feet. Your posture should feel engaged, as though your body is gently working to maintain its position, but it should not feel strained or painful. You are activating, not straining. Step 3, perform the deliberate pelvic tilt. This is the central action of the entire technique, and this is where the majority of men make their most consequential error. Slowly and with full intention, tilt your pelvis forward. Push your lower abdomen outward while simultaneously tucking your tailbone downward and slightly under. Think of it as gently arching your lower back while pushing your hips forward at the same moment. As you move into this position, you will feel your lower abdominal muscles begin to engage. A distinct, gentle activation along your lower belly. That sensation is your confirmation that your pelvis has reached the correct angle. Step 4. Contract your pelvic floor muscles with intention. At the exact moment your pelvis reaches its forward tilt, deliberately squeeze your pelvic floor muscles. The sensation you are looking for is identical to what you feel when you intentionally stop urination midstream, an upward-inward contraction of the deep pelvic musculature. You should feel a clear tightening at the base of your penis and a simultaneous drawing in sensation around your anus. If you feel both of those sensations together, you are executing this correctly. Hold this contraction firmly and deliberately for a full 3 seconds. Count it internally. 1, 2, 3. Do not rush it. That 3-second hold is not arbitrary. It is the minimum duration required for the deep muscle fibers to fully recruit and activate. Step 5, release and return to neutral. After the 3-second hold, slowly guide your pelvis back to a neutral position, not backward, just neutral, and completely release the muscular contraction. Let everything go soft. Breathe, rest in this release state for 2 full seconds. Allow blood to flow freely back through the tissue. Allow the muscles to recover before the next contraction. That completes 1 repetition. Pelvis tilts forward. Muscles contract firmly. Hold for 3 seconds. Pelvis returns to neutral. Muscles release completely. Rest for 2 seconds. You will complete 15 repetitions in a single session. The entire process takes approximately 50 to 60 seconds. As you practice, find a smooth, natural rhythm. Tilt and squeeze. Return and release. Tilt and squeeze. Return and release. When the movement becomes rhythmic and automatic, your nervous system is beginning to learn it. And that is when results start to accelerate. That is the complete technique. Edge sitting position, deliberate forward pelvic tilt, intentional pelvic floor contractions with full 3-second holds, 60 seconds per session, nothing more, nothing less. Now let me explain what this is physiologically accomplishing inside your body. Because understanding the mechanism will strengthen your confidence in the process and deepen your commitment to staying consistent. The moment you shift to the front edge of your chair, you immediately remove the compressive pressure from your perineum. The nerves and blood vessels in that region are suddenly decompressed, and blood begins to flow freely again through pathways that have been chronically restricted, possibly for years. When you tilt your pelvis forward and initiate the pelvic floor contraction, you are sending a deliberate and intentional activation signal to muscles that have been dormant. Muscles that your nervous system has, over time, essentially stopped communicating with. You are reestablishing those neural pathways. You are reminding your motor system that these muscles exist, that they are needed, and that they must begin functioning again. With consistent, daily repetition, those pathways strengthen. The muscles rebuild their capacity, the signal grows clearer and more powerful. And the result, gradually, reliably, is improved erectile function. This is not mysterious or unproven. It is basic neuromuscular reconditioning. And it works. Here is what you can realistically expect to experience. Based on my clinical observations with patients who have followed this protocol during the first 2 to 3 days, the primary experience will be a new and unfamiliar awareness in your pelvic region. A distinct tightness at the base of your penis. A general sense of internal activation that has been absent for a very long time. This is completely normal and is a very positive sign. Your muscles are waking up. They may feel slightly sore, the way any muscle group feels when reactivated after a long period of disuse. Welcome that feeling. It is confirmation that the process is working. Between days 3 and 5, many men begin to notice the early return of morning erections. They may not be complete erections at first. You might experience partial firmness, a sense that something is stirring that hasn't been present in months or years. Do not dismiss partial return as insignificant. Partial return is the beginning of complete return. It is your body signaling that the systems are coming back online. By the end of week 2, morning erections typically become more consistent and more pronounced. Men report noticing faster arousal responses during intimate moments. Things begin to feel more natural, more spontaneous, the way they once felt without effort. Week 3 is the point I often describe as a turning point in this process. Fuller, firmer erections, better staying power, a noticeably greater sense of ease and confidence in intimate situations. The pelvic floor has genuinely adapted to its daily activation, and the improvements become difficult to ignore. By the end of week 4, the majority of men who have followed this protocol consistently report what genuinely feels like a full restoration. Morning erections that are reliable and firm. Erections during intimacy that are responsive, full, and lasting. Not an approximation of how things used to be, but an actual, functional return to form. Because the body was never incapable. It simply needed the right signal, applied with enough consistency to remember what it already knew how to do. But I need to be direct with you about one essential truth. A single session will not undo years of accumulated dormancy. This is a reconditioning process, not a one-time intervention. Your muscles require consistent daily activation to rebuild the neural pathways that have gone quiet. Do this twice a day, once in the morning and once in the evening before bed. 60 seconds each session, 2 minutes total per day. That is the complete time investment required. And without exception, the men who see results are always the men who show up every single day. Now let me address the most common mistakes, because consistent effort combined with poor form will still produce disappointing results. The most common mistake is sitting too far back. You believe you are on the edge of the chair, but you are actually in the middle of the seat. Your pelvis is not tilting forward sufficiently. Your perineum is still compressed. Your pelvic floor is not activating at the level required. If you are unsure, look down. Roughly half of your thighs should extend off the front edge of the seat. Skipping the forward tilt is the next most frequent error. You are sitting on the edge, but you are sitting upright without actually tilting your pelvis forward. You are not tucking your tailbone under. Without that forward tilt, the deep pelvic muscles never engage properly, the contraction remains superficial, and you will not feel the tightening at the base of your penis that confirms you are targeting the right muscles. Moving too fast is another significant mistake. You are rushing through repetitions, squeezing and releasing without honoring the full 3-second hold. That 3 seconds is the minimum the deep muscle fibers need to fully recruit and engage. Shortening it consistently means shortening your results consistently. Contracting too lightly is equally problematic. You are producing a cautious, gentle squeeze rather than a firm, deliberate contraction. You should feel a definite and unmistakable tightening at the base of your penis with each repetition. If you are not feeling that sensation clearly, increase the intensity of your contraction. And finally, expecting results from a single session. You try this once, feel uncertain about whether it did anything, and you stop. But muscles that have been dormant for years require sustained, repeated activation before they rebuild meaningful capacity. 2 to 3 weeks of daily consistency is the minimum required to observe meaningful, reliable results. Walking away before that point means you never gave your body the opportunity it deserved. Here is your challenge. Do this twice a day for 10 days. Just 10 days. 60 seconds in the morning. 60 seconds in the evening. That is your entire commitment for the next 10 days. During days 1 through 3, focus entirely on getting the form correct. Don't worry about measuring results yet. Focus on the position, the tilt, the squeeze. During days 4 through 7, begin paying honest attention to what is shifting in your body. Note the muscle awareness, any early morning firmness, the subtle changes in how your body feels and responds. During days 8 through 10, assess your progress honestly and completely. Compare where you are today to where you started. Most men who execute this protocol correctly see clear, meaningful improvement by day 10. If this video helped you today, I would genuinely appreciate your like. It helps make sure this information reaches the men who need it most. Subscribe so you never miss what's coming next. And leave a comment below with just 2 words, "I'm starting." I read every single comment, and I want to see who is choosing to commit to this. You are not alone in this conversation, and I am here for every step of it. I'm Dr. Jocelyn, and I want to leave you with this. Your body is not broken. It has not failed you. It has not permanently given up on you. It has simply adapted intelligently, efficiently to the signals you have been giving it. Change the signal. Give your body consistent, deliberate activation every single day, and watch what it remembers how to do. Consistency is not a shortcut. It is the only path, and your body is absolutely still capable of walking it. Your chair is ready. Now, so are you.